huge impact of baldness in your personality and confidence?
I used to be in a cage mentally. I don't take pictures actually. Even then, in a group, like I'll go and hide somewhere.
There is a grade 6 baldness. We have a limited donor area. Partial coverage is possible. Full coverage might not be possible. During procedure and post-procedure outcomes by a light example. Lot of times we observe that there is a grade 5 or grade 6 baldness, which is extensive baldness. We have a limited donor area. Generally, if we inquire to a lot of clinics, they might suggest that partial coverage is possible and full coverage might not be possible. So what are the criteria in which we can opt for a combination technique of strip surgery and FE to cover these areas? Let's understand the principle of combination treatment surgery as well as its advantage and during procedure and post-procedure outcomes by a light example. So we have Mr. Ganesh with us. He is a software engineer. He is from Bangalore and he has been searching for a good transplant centers with lot of research. He came to us almost 10 months back and we followed him for almost 10 months. He is coming regularly follow-up visits. We did almost 5,000 grafts for frontal coverage, mid-skull coverage and vertex coverage. And let's have the first-hand experience of then how he thoroughly inquired about different clinics, compared, contrast, what was his expectation during the surgery and what was the expectation after surgery and what's his opinion about the results which he is getting. Hello Ganesh, how are you?
I'm good.
So it's nice that you are here and you are willing to give your genuine feedback about the surgery procedure and the outcome. So first of all, the viewers would like to understand that how you have started the baldness and what were the different modality of treatment you searched before coming to Medispa.
So it is start from my 10th grade itself. So I used to get a lot of dandruff and hair started falling. But eventually, post complete my graduation, I could see visibly the baldness in my vertex area. So I mean, like everyone, I have tried Ayurvedic medicines, and I turned to minoxidil eventually, but I couldn't continue there progressively, and I got full baldness at the age of 30.
Oh, very early.
Yes.
In your college time, it was progressing.
Yes.
And you have a family history of baldness?
Yes.
So mostly it's the genetic hair fall which we might be having and progressing towards extensive baldness.
Yes.
And started from front initially and the vertex, the crown?
No, it started from the vertex. Initially from the vertex.
And gradually extended to the
front.
So where you came to Medispa, it was almost grade 6 bald, is it?
Yes, yes.
During your college time and after that, how you are managing your personality? Because obviously looking what's balder doesn't suit as a sent into anybody.
So I'm already kind of introverted person. So I used to be in a cage mentally. So I don't interact with people much and I don't go out much. So it is pretty much dire situation there.
Oh, so it was a huge impact of baldness in your personality and confidence.
Yes.
So you used to wear a cap or to hide it and what we were...
Initially, I don't care since I don't out much, but eventually I had to work. So in my workplace, I always wear a cap.
Always?
Yes.
So nobody knows that you had a baldness?
Yes. And unless they know me personally, they don't know.
So most of the time when you are clicking pictures in your family pictures or in professional meetings, so you used to be open for picture taking or what? How?
Generally, I don't take pictures actually. Even then in a group, like I'll go and hide somewhere in the corner. Yes, I don't
avoid everyday pictures.
Yes, even my phone, I don't have pictures of mine. Yes.
So it was really a big impact on your personality and your confidence.
Yes. It is, it was actually. So it used to break my confidence at this level. Even for applying interviews, I used to not take video interviews or personal interviews. So it is impacted me to extent as well.
So when did you first thought of that you should change your personality by transplant or getting your hair back, and how you researched about different things and came to know about Medispa?
So when I was hitting 30, eventually I used to see people who got transplant, and I thought I can also change my life. So eventually I went to Reddit and search in forum.
Reddit is a forum.
Yes. Social media forum. Forums we can get genuine feedback from people who actually gone through.
Very true. So Reddit and there are forums in which genuine patients come there, get the genuine feedbacks, and you get compare and contrast different clinics, how they are performing.
Yes.
So Reddit is one. Some more you have undergone to investigate?
Initially, like in Reddit forums, like kind of understood like what kind of clinic I choose and what kind of doctor I choose. So like the suggestion was to go to the individual clinic and the doctor who is specialized. So if you go to some corporate or something, you get the label and brand, but you don't get the doctor you want.
Absolutely. This is very important to understand that whatever surgical procedure you are undergoing, surgeon is the main key behind the outcome.
Yes.
Just the brand name will not give the outcome, because a brand name has different type of surgeons operating under their name, and different type of surgeons will give different type of outcomes. And then it's your luck whether we are going to a right surgeon in that brand or a new ones. So it's really not precise that how you will get the final outcome, because brands are promoting their best outcome mostly, and they're not disclosing which doctor has performed this surgery and which doctor will perform your surgery.
Yes.
So obviously going behind brands is not a fruitful idea. It's not a logical idea to get a good result, isn't it?
Yes.
So then how you research about different doctors and what parameters you thought scrutinize before searching and finalizing medicine?
So initially, like I have seen people who is not into dermatologists doing such surgeries as well. So like my fixation is to like go with the doctor who is clinically qualified and to have testimonies as well. So and since I got you in YouTube as well, so like and went through several videos and I finalized.
Very important. So important is the clue which you are given. We have to see the qualification of the doctor. So by MCI guidelines, there are only two types of doctor which are qualified for doing transplant. One is plastic surgeon, that is MCH plastic surgery degree, which is a high qualification because it is obtained after doing your MBBS, your general surgery, MS, and then MCH is a super specialty qualification degree. So a MCH plastic surgeon as well as the dermatologists who are having 1 year more experience in hair transplant training. So dermatologists are MD dermatologists. So we have to look for specific clinics which are qualified, having qualified doctors like dermatologists, plastic surgeons, and who themselves are performing the surgery. Because there are a lot of clinics in which you can see the name of a doctor, but under them only the technicians are performing the surgery. So always before going to any clinic, you should understand and ask and inquire whether the clinic, in that clinic, that doctor is going to perform the surgery or just the technician. Is it? That's very important way to identify a good surgical clinic. So also you mentioned that you have researched the reviews.
Yeah.
So what different reviews of different clinics you have seen and what different thing you sorted out from that?
So reviews in the sense like in the forum itself, they say like they have prescribed, I mean they are advertised that one doctor will perform, but eventually that doctor will not be available at the time of the surgery. And some clinics do not follow up, and in some clinics the results were not like up to the expectations. So like
you reviewed lot of different type of reviews, and specifically you have deep dived into negative reviews.
yes,
Where you can find that whether the doctor was performing the surgery or not.
yes,
And whether the appropriate results have obtained, how is the satisfaction rate of different type of patients, and what reviews they have posted. So especially you search for the negative reviews.
yes. So I thought I should get the bare minimum, like I should be in a safe space. So I went through negative reviews and sorted out based on that.
Very good. So apart from reviews, what else you are thinking about the results? Because obviously you are a computer engineer, you can see the difference in pre and post operative photographs as well in videos. So according to you, what are the important criteria to observe the results?
Results in the sense, some results which I saw with my friends itself, so they are pretty much artificial, and you can clearly say from 10 feet distance that is artificial.
And naturalness is the thing which you are looking for.
Yes.
So designing and naturalness is the thing which you are looking for, and it is the absolute criteria to get the results in the best form. Because naturality is the key for the successful transplants. So you're observing cleanly the designing pattern of different outcomes or different results of different surgeries.
Yes, yes.
So what you have observed?
So actually, like in some cases, I don't feel that is like complete transformations, or it is like clearly visible. At some cases, it fails after some years as well. I mean, I research on that part as well. Then too.
Absolutely, very intelligent thing that you should research in such a way that you should go and think and see for the long-term follow-up reviews, which is important because sometimes, as you mentioned, there is a long-term follow-up review in which they might mention that there is a problem of falling of transplanted hair or loss of the results in long-term follow-up, which is very common nowadays because of extensive use of FU. When we use FU extensively, we harvest hair from unsafe areas, which is quite high and quite low from the back of the scalp, and that hair has short longevity. And after a few years, you might see thinning in the donor area on non-safe areas, as well as the hair which were implanted from that area in the front. These also get thinner and they fall out, and the overall density goes depleted with time. So it's a very important thing to be observed that what are the long-term follow-up results and what are the long-term follow-up reviews of the patients. Very good. And then you scrutinize and you rank few doctors ultimately that to choose from. How to do that?
Yes, like I mean, again, this forum suggested me mostly in doctors in Delhi area and Jaipur and few of them in the south. But eventually, since one of my friend actually went to, I mean, suggested that Jaipur might have a better place and with good results and in an affordable price. So I choose Jaipur actually.
So coming from Bangalore to Jaipur, it's a difficult decision.
Yes.
Lot of your family, friends, relatives might have been questioning that why not go to a metro city? Why to a smaller place, Jaipur? So then what was your answer?
My answer is like results are important rather than a place. So I choose doctor and I choose the results and I eventually chose.
Absolutely true. So doctor behind the surgery is the most important key factor for the final outcome. Consistent results of the doctor, natural designing pattern, the artistic sense of doctor will actually give the final outcome. So when you consulted Medispa, so what was the thing which we suggested to you and what was your thought about that?
So initially when I got it in Medispa, I was asked about give the actually photo evidences, and based on this they suggested combination treatment of FUT and FUE. And they suggested race as well. Then I asked surgery posture and other follow up, like is there be any follow ups or not. They answered pretty much to my satisfactory level. Then I chose this.
Very important that whenever you get a query to your clinic, how quick the response, that also shows their attentiveness and their involvement with the patient consult. Also, you mentioned the follow up. Follow-up is very important for any patient to have a final outcome, a satisfactory outcome, because in between there are a lot of things which have to be taken care of, lot of things, smaller things which we should tell patient how to do head wash, how to do massage, how to use minoxidil, or how we moderate your finasteride level, how to do combing pattern. There are a lot of things to be discussed. So we have a strong follow-up team so that every monthly at least you get a call. And even if you call, then they promptly reply.
Yes.
So are you getting good follow-up response from Medispa?
Yes, I do. Even last month I called them for a doubt, and immediately they responded and cleared my doubt. And even there also a feedback call from Medispa. So yes.
So you are happy with the follow-up team?
Yes.
What about the surgical procedure itself? When you underwent the surgery, the day of surgery, how was the pain control, the cleanliness, hygiene, safety precautions, and how much was the involvement of the doctor itself, like me, and what you expected, and how was overall thing during the surgery, during the day of surgery?
Yes. So initially I was pretty much scared actually. I never went to a surgery before, but here it is everything is nice and clean, and it was very comfortable. Staff was very helpful actually. Doctor itself made me very, very comfortable. And on the surgery day, I was pretty much taken care of entirely. So there is no much pain and all, but it was a very good experience in my opinion.
Yes, So it's very important to have a very nice, comfortable experience during the surgery. We especially take care that a day prior to surgery, we do proper counseling of the patient again. We drew the hairline and have a proper understanding of the procedure outcome, which is important for a patient. The day of surgery, we make sure the surgery goes very pain-free, comfortable, because every patient is scared of pain. So we have a special arrangement of reducing pain. I have developed some local anesthesia injecting techniques, which you might have observed, the vibration and the slide pack, which reduces the pain during injection giving technique, as well as when we give local anesthesia. I have developed such a anesthesia which works for 10 to 12 hours. So you might have observed we were not giving local anesthesia again and again after 2-3 hours, isn't it? Yes, because these local anesthesia generally work for 2-3 hours and people have to re-inject it. The injection is itself painful procedure. So when we avoid this re-injection, during the procedure you are comfortable. During the procedure you take a breakfast, you have your lunch, and you can use washrooms. So we make sure the procedure itself is pain-free and comfortable. Very next day we start head wash. That might be surprising for you.
Yeah. I thought like the surgical procedure was very complex, and I thought initially I may not be able to move actually. But I was very normal then the very next day, and the head wash also is done, and I could personally do a head wash myself in upcoming days as well. So it was pretty much a good experience.
Post-operative protocols we have kept very simple, just a simple head wash. You can lie on your back. So sometimes people are scared whether you can lie on your back or not. There are stitches, whether you have to remove it, how much it will hurt. So we do a absorbable suturing technique, a pipe-fighting suturing technique, so that you can lie on your back also, and the sutures are absorbable. No need to come back for removal. So absolutely psychologically you're free from that removal of stitches. As well as because the trichophatic closure, you might have observed the scars are not measured. There is no major gaps or the scars. We did a combination of strip surgery and equi. The strip and equi combination gave almost 4,000 grafts from back of the skull without much of density depletion on back of the skull. Yes. You also harvested a beard hair. Is it? Yes. So obviously when you have to come prior to surgery, you are scared that Dr. Beard harvest, whether it will go and how will be the scarring. So how was the experience about beard harvest of the image we did during the surgery?
I mean, initially I thought there will be spots which I can spot in naked eye, but I couldn't actually. So surgery was like, it was not that painful, and eventually when I grow my beard back, I mean, I didn't spot any difference.
Absolutely. So when we do beard extraction, we make sure there is no facial change which happens after beard extraction. We extract beard from under surface only with micro fine punches of 0.05 millimeter diameter, which doesn't leave any scar. So in fact, you can say it is scarless if you extraction from beard.
Yes, there is no scars now actually.
You can shave it properly.
I could shave, I could trim, and it's possible.
We make sure that it should be not having any side effects in future, and it is clean shave as possible without much of scarring. Any visible scarring is not there. Best part is we are using this valuable beard hair to fill your vertex, then crown, because even with 4,000 grafts from back of the scalp, we can't fill all grade 6 baldness. So we have to distribute in such a pattern that frontal area is little bit denser, mid scalp little less denser, and for vertex, the crown especially, we utilize the beard graft. So if you have observed the designing, which is a special part of Medispa, especially make sure it is to be run personally for me, always artistically according to your facial features. So I do a hairline which is suitable for your face. I do a frontal widow's peak if you have observed, a proper shade, the temporal triangles, and single hair graft for frontal hairline. So after doing all this designing part and getting the results, does this look natural?
Yes, absolutely. Even my mom got stunned that like I grew my hair back, which I was used to have earlier. So it is a pretty pleasing experience for me. Like, yeah, it is unbelievable, right?
Like, what about the naturality or the design? How important is the designing part? Because a design is the key, according to me, for a final outcome to improve the confidence level of a patient. So how is your design and what is your take about the designing part of the transplant?
I feel like if you are not doing a proper design, like is as good as like not having surgery itself, because will not have again. I would have lost the confidence again. I would have. Like, I mean, I would have worn a cap all the time, like I used to do earlier. So there would have been a much, not been a difference if I have done a poorly done design on my hair. So it is actually made a difference in my.
So bad design is actually a hazard for the transplants, and actually it will never ever improve your confidence. It will actually reduce your confidence back to the square zero level. So always emphasize on the designing, see how the natural design it. So in your hairline outcome, how natural it is and what is the reaction of normal people who never ever knew that you had a transplant?
So pretty basically, like since I wore a cap all the time, like when I took a cap off like what 2 3 months back when I started growing my hair. So people, I mean, never doubted that I had baldness actually. So like it pretty much natural, and nobody ever questioned me that I had a transplant or not. So that is like a key difference here, and I was very happy with that.
Thank you. So that is the key of getting a natural hairline. And how we identify whether it is a natural hairline or unnatural? By people's reaction. If people are non-reacting to your hairline, that means it's natural. If people are reacting or staring on your hairline, looking for your hair, not talking to you with eye contact, that one is not natural. So unless you get a natural hairline, people are going to observe your hairline, it's looking something different, and you'll be always cautious. And because you had a transplant, you will always be wondering why they are looking to your hair, and it breaks your confidence, it breaks your concentration, and whatever work you're doing, you're lost.
Yes.
So always naturality is a priority for a hair transplant to get it, and that is the key for getting your confidence back, isn't it? So we covered your frontal area, mid-scalpel vertex with little bit low density. We expect it to go further, and best part is if you want to improve density in your vertex or the mid-scalp area, we can redo one more transplant. That is the most advantageous point of doing a combination treatment. So strip and FUE, we have again the laxity back, and we can re-extract a strip without two scarring. We can merge the second scar to the previous one, and again there will be only one linear scar, not two, and we can again harvest some more FE from back of the scan because we do not over harvest in the first session. We can extract some bare also. So even after implanting 5,000 grafts in your case, we can re-extract and implant maybe 4,000 plus more grafts for a mid-scalp and vertex region. That too without much of density loss on the back of the scalp. That is the key and advantage of doing a combination treatment. So have you ever expected that so much of hair will come back and the density loss and backside will not be much?
Yes, there were cases which I saw, like eventually they were complaining about spots on their back after a FE. Since they are like completely doing a FE and on the back of a skull, like that is a noticeable difference there. But in my case, like I didn't feel anything actually. Even since I'm growing hair, like I don't even spot the scar. So that is good actually.
Absolutely. So if we try only actually to extract 4,000 grafts from back of the scalp, it will look very sparse. And second extraction will become very difficult. So for higher grade of borders like grade 6, the only AP technique will never serve the purpose. It will become a half-hearted attempt. You'll get something in the front, something in the mid-scalp, the vertex remains empty and don't have enough area left to cover the vertex or improve density in mid-scalp in future. So advantage of combination is manifold. Once you get the good density in front, you have a good density left in the back, you can have a second session. Best part is if it is done with qualified plastic surgeon with good aseptic precaution, no side effects, and outcomes are more natural, more gratifying. So overall, what you want to suggest for people who are thinking for transplant for higher rate of baldness, and obviously they are scared of traveling from different cities, especially to a smaller city like Jaipur. What's your take for that?
So initially, my suggestion is from my life lesson, like do not hesitate. So consult a qualified doctor. doctor is more important than brand. So do not hesitate in it.
Thank you very much for your genuine review, and we would like to thank you from our team also that you come here for giving your follow-up reviews, and keep be in touch so that we can help you out in further cases. Like if you have some want to improve your vertex or mid-scalp density, will be very helpful for that, and we'll try to do the best job for your future also. Sure. Thank you.
Thank you.